Caution and panic. There's a thin line that separates the two. It's good to be cautious, especially when a new variant is spreading quickly. You must be cautious. But what happens when you panic? Your responses become extreme, even counterproductive. And here is what they look like. In China's Jingxi, 4 people violated Wuhan virus restrictions. The local police rounded them up and paraded them on the streets like they were criminals. Look at this. Repeated lockdowns, mask testing, travel curbs, vaccinations. China has tried all of this. But it still cannot enforce its zero COVID policy. So it has now resorted to public shaming. Can shame help us defeat the virus? It cannot. Science can. And that's exactly what we'll talk about in our cover story tonight. The Wuhan virus has thrown another challenge. It is called Omicron. The new variant will become the dominant strain across the world. It's not a question of if, but when. New infections in India have surged by more than 40% in 24 hours. The WHO is warning of a tsunami of cases the world over. So what should India do? What should the rest of the world do? On Gravitas tonight, that's what we'll discuss. As always, we'll start with the numbers. The past few weeks have seen an explosion of cases. New infections are going up worldwide, including here in India. Cases have shot up by 44%. At least 14 cities have witnessed a spike. But Delhi and Mumbai are the worst affected. In Delhi, new infections have jumped by 86%. 86. In Mumbai, 82%. Omicron could be fueling the surge. Delhi and Mumbai have the maximum number of Omicron cases. Across India, this new variant has been detected in close to 1,000 patients. It has spread to 22 states and union territories. That's practically the whole country. Is this the beginning of the third wave? It seems like it. Let's look at 2 projections. The first one is from the IIT, Indian Institute of Technology in Kanpur. It says the third wave began in mid-December and cases will continue to climb through January. They will touch the peak on the 3rd of February. So IIT Kanpur is predicting a surge that won't last as long as the second wave. Another study, in fact, has thrown up similar findings. This one is from the Cambridge University in the United Kingdom. Their tracker says India will see another surge, but the third wave will be short-lived. And that's a plausible argument. Why do I say that? Because that's exactly how Omicron behaved in South Africa. That's where this variant was first detected. Initially, there was an explosion of new infections. Close to 27,000 people were testing positive every day in South Africa. But now the Omicron-fueled surge seems to have peaked. Last week, South Africa recorded around 15,000 cases. As of yesterday, new infections have dropped to below 10,000. Look at this graph. It shows a steady decline. There is another key takeaway from South Africa. The infections are mild. Doctors did not see too many patients getting seriously ill from Omicron. Out of 1,000 patients, only 58 had to go to hospital. 58 out of 1,000. Not many of these patients needed oxygen or the ventilator. Now, for perspective, let's compare this to previous variants. Earlier, 30% of the patients were admitted to ICU. With Omicron, that number is down to 13%. So it's not as bad as it could have been. Plus, we now have shorter quarantine periods. Several countries are easing rules for isolation. Like the United States, the Centers for Disease Control and Prevention, or the CDC, has changed guidelines. Wuhan virus patients will now have to isolate only for 5 days, not 10, as was the rule earlier. 5 days of quarantine, and you can step out if your symptoms are gone. Same with the United Kingdom, shorter quarantine periods. From 10 days, it's now down to 7. If you're in Italy, if you come in contact with a patient, you don't have to self-isolate anymore. They have scrapped that rule. If you're vaccinated, you can go about your life. If you've recently recovered from an infection, you can still step out. All of this sounds good, and I hate to be the bearer of bad news. But here's the thing, the virus from Wuhan is still dangerous. Let none of the reports of mild infections make you complacent. Omicron may not be as deadly, but it can still overwhelm health systems. It's already happening in the West. There is a shortage of testing kits, hospital beds, and medical staff. The United States is by far the worst affected. Today, it reported 512,000 new infections. 512,000 new cases in 24 hours, more than 5 lakh in a day. This is America's biggest single-day spike since the beginning of the pandemic. The American healthcare system is struggling to cope. The U.S. National Institutes of Health, or NIH, has decided to postpone all elective surgeries. Here is why. At least 80 staff members have called in sick. Either they've been infected by the Wuhan virus or they have been exposed to someone who has tested positive. The NIH labs are also running short of chemicals they need for Wuhan virus testing. So Omicron may lead to mild infections in most of the cases, but it's causing too many cases. And what happens when too many people fall sick? Hospitals are overwhelmed. Doctors have to choose. Who do they treat first? They tend to prioritize Wuhan virus patients. So those suffering from other serious diseases bear the brunt. They might not get the care they need, like those who need a dialysis or chemotherapy for cancer. And we cannot afford that. Tomorrow is the 31st of December, the last day of the year, the perfect opportunity for a variant like Omicron to spread more. So I'm going to ask you to be cautious. How do you stay safe? First, get vaccinated if you haven't already. Keep wearing your mask. Avoid large gatherings if possible, like weddings or election rallies. If you do have to meet someone in public, make sure it's an open and well-ventilated space. And watch out for the symptoms. 4 symptoms: cough, fatigue, joint pain, and headaches. With Delta, you may remember, loss of smell and a sore throat was common. With Omicron, the symptoms are more benign, which is why we need to be more careful. The pandemic will enter a new phase in the new year, and we'll have to change our approach to deal with the virus. You see, in 2 years, medical science has come a long way. We understand the virus, we have medicines, we have vaccines. But our response has not evolved. We are still resorting to lockdowns and restrictions. They have an economic cost, they have a psychological cost. They can slow the spread of the virus, but they cannot end the pandemic. Lockdowns cannot end the pandemic. They're not a permanent solution. So don't stop living, just follow the protocols. If you're going for a New Year's party, try not to bump into Omicron. WION is now available in your country. Download the app now and get all the news on the move.